Good morning, everyone. My name is Cassie Hopkins. I coordinate the webinars for Hausman Johnson Insurance. I would like to welcome you to today's webinar, ACA Update by Pat Kelly. Today's webinar will run for the full hour. If there is time after the presentation, we will have a question and answer session. If you have a question during the webinar, feel free to type it into the question feature and John and Pat will address it. After the webinar is over, there will be a short survey we are hoping you can fill out for us to give us feedback on the webinar and webinar topics you are interested in learning more about. Feel free to share your thoughts on LinkedIn or Facebook and tag Hausman Johnson Insurance. This webinar will be recorded and will be available on the webinar archive section of our website. Each attendee will receive a follow-up email with a link to the recording and the presentation slides. I would now like to introduce you to our presenter for today's webinar, Pat Kelly. Pat has been with Hausman Johnson Insurance since 2011 and has 20 to 30 years of experience in employee benefits. He is passionate about building a relationship with clients beyond just being a product vendor. He forms client connections through honest communication, continuous education, and always doing what he says he is going to do. Pat works with employers of all sizes and with both fully insured and self-funded medical clients, including defined contribution, HRA, HSA, and FSA. He also works with clients on their disability, life, dental, and vision needs. Pat graduated from the University of Wisconsin-Madison in recreational resource management. Pat was a UW Badger football player from 1976 to 78, as well as a professional rugby league player in England and France from 1979 to 1980. He still loves being active year-round and shares activities such as biking, skating, skiing, and snowshoeing with his family. Welcome, Pat.
Thanks, Cassie. See, 1978, that's a long time ago, but thank you. So, Affordable Care Act update, got a lot of topics I want to talk about because it really, with our current situation in Washington, D.C., there isn't really a lot going on right now. There's a lot of talk about what people want to do, but not a ton going on. Just this morning, I'm part of a group called Benefit Advisors Network, and we have a monthly compliance call with attorneys that specialize in benefits and ERISA law. And the first 5 topics that we're discussing today: ACA litigation update, 3 of those, and I'll talk a little bit about what's going on with the ACA and some litigation update. Energy and Commerce Health Subcommittee held on the government's issue to undermine the ACA, and Medicare for All. So these are things we're hearing about in the marketplace, and gee, I wish I had that call last night. I might have had more things to talk about today, but so that's kind of what we're seeing today. We're seeing a lot of things in D.C. Obviously, we have 2 parties, and one party controls the Congress, and one party controls the Senate and the president's office. So obviously, are we going to see things get done? I'd like to, but it's kind of shaken out that it doesn't look that way. So enough of the political side of it. We'll get into my update. Topics today will be association health plans, short-term medical plans, individual mandate, large employer penalty, affordability updates, notification of individual subsidies, IRS employer shared responsibility payment notices, ACA reporting, PCORI fees, small employer health reimbursement arrangements, health savings accounts, workplace wellness and compliance with the DOL and the EEOC, talk about some extension and delays, a couple bills, again, that have been passed but didn't get anywhere, and just kind of looking ahead. I got to talk about that a little bit. So first piece here on association health plans is they've been out now. We've had some in force since last September. I think one got added a little bit later than that. So currently, to the best of my knowledge, I've only seen 2 association health plans that are operating as Wisconsin Association Health Plans. These are both fully insured plans underwritten by United Healthcare. One of them is through the Wisconsin Manufacturers of Commerce, and the other is with the Wisconsin Bakers Association. I have not heard or seen of a lot of growth with these yet. I believe they're targeting small employers. Typically, small employers would be less than 50 for sure. And even with that, we think they're really targeting, even smaller employers than that. At this time, we only have fully insured plans that are out there with these two associations. As you see in my next bullet point, Wisconsin and many states have very strict guidelines on self-funded association plans. Unfortunately, back in the 80s and 90s and even the 2000s, there were a lot of plans that were out there. They'd pop up, they were self-funded, and they'd collect money they'd make, and then didn't have the best intentions for the clients that they were insuring, and they'd exit the state. And so many states have very strict laws on self-funded plans. So if those rules aren't relaxed, we won't see that in the state. We'll just see the fully insured plans. And at this time, there hasn't been a lot of growth in them. I know the Wisconsin Manufacturers of Commerce, they came out with theirs, and after about 2 or 3 months, they increased commissions. So we have not written anything through that plan because they're not even trying to write business in 19 counties, which would be the counties dominated, by our strong HMOs here in south central Wisconsin and the southwest part of the state up through La Crosse and so forth. And the other thing going on outside of Wisconsin, I haven't seen anything in the state here yet, but many states have filed lawsuits challenging the association health plans. So a lot going on with those. I'm not going to talk about the logistics of them. I did in my meeting, my webinar back in August of last year, but so I'm not really going to talk much about that. It's just kind of what's going on with them and slow growth. The next item, again, that these are newer, are the short-term limited duration insurance policies that are available. These are being marketed in Wisconsin, and just depends on where you live, what carriers are marketing. But these are the short-term policies. The old rules was you could only buy those for 90 days, and the Trump administration increased that up to 12 months, and you could have them for a period of 12 months, and they could be renewed for up to 36 months, taking into account renewals or extensions. The big kind of problem here or concern here is they do not have to comply with the ACA guidelines to be considered health insurance. So these policies can have pre-existing condition limitations, which other policies that comply with ACA guidelines cannot have. And they don't have to comply with the essential health benefits that individual policies that are on the marketplace have to comply with. And again, right now what we are seeing, and these haven't been out that long, currently many states are investigating the carriers and the coverage offered, saying that they're seeing troubling practices like denying coverage and misleading consumers. So again, it's unfortunate that people have to see that, but we're going to see challenges by states on these policies as well, and so forth. There's lawsuits by consumer advocates challenging the short-term rules that are out there. So just a lot going on with those as well, and so forth. Next, individual mandate. A lot of talk on that because the individual mandate and what's going on as of January of 2019, individual mandate has a lot of effect on the employer mandate for the large employers. And just what happened in 2019 with the Tax Act that was passed in 18 is they zeroed out the individual mandate tax. So there's no more, some people say penalty, but technically it's a tax. They zeroed that out. So, if individuals don't buy individual coverage, if they don't have it through their employer, there's no tax to them anymore. And that tax was upwards to for 18, it was 2.5% of someone's earnings with a minimum of, I don't have the exact number, but it was like $750. So it started to have some bite and so forth. So the ACA has not been repealed because of this. I will touch base with a little bit later on a state's lawsuit challenging the ACA because of the fact that there's no more tax attributed to the mandate anymore. But currently the ACA has not been repealed. And remember, it's the individual mandate is not what drives employer penalties. It's when an employee receives a marketplace premium tax credit. That's what can trigger employer shared responsibility payments. So if you have an employee that does qualify for a tax credit and you're a large employer, that could result in a penalty back to the employer. And because of the fact that there's no more tax or penalty associated with not having individual coverage, the Congressional Budget Office predicts that there'll be 13 million fewer will be insured by 2027. So that, that tax or that penalty tax did have some bite where, it kind of had people buying coverage because of it and so forth. Okay. So the large employer penalty affordability update, the penalties for, I have 2016. I don't have 2015 up there anymore. Kind of moving ahead here. But you can see for 2016, that first penalty, the 2160 or 2260 or 2320, those penalties, those are what we call the A penalty. That's the penalty if you are a large employer and you don't provide coverage at all. You don't provide at least minimal essential coverage. And that really, if you didn't provide that, you weren't really providing coverage. That's the penalty that you could be stuck with. And that's the penalty, what we call the sledgehammer penalty, because that is, you take all your full-time employees, subtract 30, and multiply by that number, and that's what your penalty would be for any 1 year where you had an employee that went to the marketplace and got a premium tax credit, and then that penalty would come back to you. The second one there, the 3240 or the 3390 and so on based on the year, that's the B penalty. That's the penalty if you offer minimal essential coverage, but it's not affordable or doesn't meet minimum value. That is a penalty based on per individual who got a marketplace premium tax credit and so forth. So that's a lighter penalty, but it's still a penalty. And the penalties are prorated for the month that member, that employee, got a premium tax credit. So it might not be the full 3240. It could be, if they got 5 months of premium tax credit, just prorate that down to the 5 months, and that's how it works and so forth. The affordability update on the percent of what is affordable for the employee, we see that there. So you look at 2016, it's 9.66. Sorry, I didn't get my percent in there. 2017, 18, and then for 19. So for 19, for 18, the percent penalty, the percent of affordability was 9.56, and now it's gone down. It's actually, the percent's gone up in 19, which kind of increases the cost could increase the cost to the employee of what's affordable and so forth at 9.86. It's and if you look at the federal poverty line, I like to show that just because some employers don't want to be subject to any penalties at all, and it doesn't guarantee it because you have to offer coverage to 95% of your employees. But if you're only charging employees these amounts, like in 2016, if you were only charging your employees $94.74 for the lowest cost single coverage you offer, that would pretty much guarantee you would not be subject to any penalties. Because if anybody, if the cost was that or lower, that would mean the incomes that those people would be earning would be less than the federal poverty level at 100%, and they would qualify for Medicaid. So those are kind of guarantees there that they're not 100% guarantees, because again, there's other little quirks which could trip you up and and make you responsible for a penalty. But for the most part, that's kind of that dollar amount for affordability and so forth. And we do have some employers that are charging that much or less to their employees for single coverage. So it kind of washes their hands of the penalty and so forth. So what happens if you have an employee that actually goes to the marketplace and gets a subsidy? You are supposed to receive a certification. The certification is called 1411. Initially, there are a lot of these going out, and we haven't been hearing of very many going out lately or getting calls from our clients. But this is a notice that is just letting you know as an employer that you have a member that says they're an employee of yours that received a marketplace subsidy or premium tax credit. So you would get the letter notifying you that, and if you're appealing that, you need to appeal within 90 days as to why you don't feel that member is due a subsidy. Now, originally when these came out, we were having employers call us up and say, this person hasn't worked for me for 8 months, 12 months, sometimes even more than that. The problem on the other end was for the year 2015, the year 2016, marketplace subsidies were basically being determined by the honor system from the people coming in and requesting them. So there really wasn't a lot of data that they were looking at to prove whether this employee was full-time, what was the cost of their coverage where they worked. They were just filling out a form and saying whatever they wanted to say, and they were qualifying for marketplace subsidies. So because of that, if you get this, you don't have to appeal it. The marketplace doesn't determine penalties to employers for the employer mandate. The IRS does. So you don't have to appeal it. But the reason why we kind of recommend that you appeal it is really it's in the best interest of your employee. I see a little typo there. It should be, it is in the best interest, not I. But the reason why it is if it's deemed that employee or past employee or that person was never eligible for that subsidy, they will have to repay it eventually. And they catch up by repaying it when they pay their taxes. Or maybe they don't get a refund, those refunds will help pay those penalties and so forth. So probably better not to have them get it now and not have to repay it later. So, and again, I just said a little bit, the IRS, not the marketplace, determines if employers are due penalties. And this is what we're going to talk about next. So IRS ESRP, that stands for Employer Shared Responsibility Payment Notifications. These letters went out for 2015, and now that the IRS is back working again, these letters are going out for 2016. I had 3 calls last week from clients that received these letters and so forth. Good news is, after looking at the situation and talking with our clients, we don't feel any of the clients are going to be due any penalties, which is kind of nice. And I'll knock on wood, to date, unless someone hasn't called us and told us they paid a penalty, we had no known clients yet that have received these letters that have had to pay penalties and so forth. They've all been able to get the reasoning behind the letter nullified, and IRS is backing off. In 2015, the IRS sent out 30,000 plus notices for penalty assessments that totaled over $4 billion. Now, they've not come out and said how much they've collected, but I'm sure they've collected some, but if it's based on the good fortunes we've had with our clients, so far we know it's zero, which is kind of nice. But and mainly in 2015, the reason why so many letters went out were just incorrections, misunderstandings, things like that. It was the first year, the IRS probably was looking at things and the marketplace was doing things. Remember, it was the honor system getting an individual marketplace subsidy. The IRS was trying to coordinate all this for the first time. employers filling out their forms, might have checked something wrong, and they correct that and no penalty. So it'd be nice to see, be interested to see if the IRS ever comes up and says, hey, how much we actually collected in 2015 for these penalties and so forth. I got a feeling 2016 is going to be similar. I don't think it got any better with the coordination between all the parties to do this right. So I got a feeling it's going to be the same way. But that said, that letter is, you need to look at it. You really need to read through it. You need to talk to somebody about it. 7 to 8 pages long. You should read it. The most important item on that is first page, upper right-hand corner is the response date. Please respond by the response date. That's probably the most important thing in there is your response. Don't set it off the side and say, I'll get back to this later. Respond, and I would do it right away. Obviously, the other item is going to catch your eye is the proposed penalty amount. We've seen them up to $500,000 and everywhere in between that. So very important. So if you agree for some reason that you are due that penalty, you check the I consent to the assessment box on the form 14764 and indicate how you're going to make the payment. Or if you disagree with the box, or you check the disagree box and then comply with the information requested under if you disagree with this request, which is page 2 of the letter you receive. Read that, let them know why you disagree, check the box that you disagree, sign it, and send it in. And then obviously wait for their reply. We've had many clients also, same thing, upper right-hand corner, there's a bunch of phone numbers, and there is a phone number you can call. We've had employers call and talk directly to the IRS and kind of get a confirmation that, yeah, based on what you're telling us, you're not due any penalties, but still follow up and send the form in, sign it, and again, explain why you don't feel you're due this penalties. And depending on the circumstances, you may not want to go this alone. Like I said earlier, you should call your agent, a third party, if you've been dealing with a third party, completing all your reporting paperwork, or legal. If there is reason to bring legal in, the good thing that will give you is, that will give you client attorney privilege for matters discussed. If you talk to me or a third party that's not legal, and something does get to court, then there's, anything you told me, I have to divulge, or another third party. Or if you talk to an attorney on this, then you have that protection. So it depends on the situation, obviously. If you're looking at potentially having a penalty of thousands or tens of thousands of dollars, obviously you'll be getting an attorney involved and so forth. And if it's something simple, like you forgot to check a box, I don't think you need to. You check the box and send the updated form back to the IRS, and you should be able to move on without any penalties. And one thing the IRS is also doing currently, they're contacting employers that they believe should have filed the ACA forms. Those are the 1095s, the reporting forms. There's been letters going out for 2015 and 16, and again, you need to respond to these letters as to why you did not file in 30 days. We are now working with a potential client who was a large employer and was a large employer back in 2015 and 2016, but they didn't provide any health insurance to their employees. It's just an industry they didn't feel they needed to, so they never sent in the employer reporting forms, the 1095s, that everybody that's a large employer has to. They just didn't know it was out there. So now they have to go back and report for those years. They're not going to be penalized because as soon as they got the letter, they responded and they did everything they needed to do within that letter. So that's going out as well. So ACA reporting, well, most of this is past news because it's for the reporting this year. You had to have your employee forms in their hands by March 4th. So however you compile the forms and get them completed, they had to be to your employees March 4th of this year, obviously. So we're behind that. If you file by paper, the IRS had to have received those forms by February 28th. If you do file by paper. If you file electronically, then the IRS, you have to have those by April 1st. So for that, you have a little time yet. And a reminder, any employer that submits more than 250 1095-Cs per tax ID number, you have to submit electronically. So you're probably going to use a third party, a payroll vendor or a third party to be submitting those for you. Many employers don't have the required data connections they need with the IRS to be able to do that themselves electronically. But remember, it's per tax ID. So if you have four tax IDs that are all kind of under one common control group, none of those tax IDs have more than 250 1095-Cs. You can submit those by paper if you want to. But one tax ID, you have to submit electronically. Okay, here's kind of eventually be some good news. PCORI fee. These are fees that self-funded self-funded employers use. It's a fee based on it's called Patient Center Outcome Research Institute. It's just a fund research of medical outcomes and so forth. So if you're self-funded, you've been filing this form. And if you've had a health reimbursement arrangement, you've been filing this form or this fee, apologize. Or if you have a health reimbursement arrangement and haven't been doing it, you should have been paying a fee for this. And the fee is based on your average number of employees or average number of member lives. It just depends if you're self-funded with a true self-funded health plan or if it's a health reimbursement arrangement. So the good news is this fee no longer applies to plan years that end on or after October 1st of 2019 this year. So eventually, this is going to sunset at this year. For plan years ending on or after October 1st of 2018 and before October 1st of 2019, the fee is $2.45 times the average number of lives. That's for a self-funded plan. So that's not just counting employees, that's counting all members, so employees, spouses, kids. That's for self-funded employers. If you have a health reimbursement arrangement with a fully insured plan, that's the average number of employee lives. So there you just count employee lives. So you take that average, multiply it by 245, and that's the fee that you have to pay by July 31st of this year. Obviously, will have to be paid, and that will be paid for 2018 plan year. So it should be ending this year because see, I get my dates goofed up on this. Should be ending this year for most people. I don't know if it's going to be paid by some in 2020 yet, but that is one fee that's ending. The good news is it was never a real high fee. It wasn't something that was just tough for you to pay because $2.45 times is not it's one of the smaller fees that has been added to the Affordable Care Act. There's something, again, that's still out there for small employers. There is a qualified small employer health reimbursement account that can be set up. It's for small employers only. There is some talk out there of trying to expand health reimbursement arrangements for even large employers. And these are health reimbursement arrangements that allow employers to provide dollars to employees to pay for individual coverage. Currently, you can't do that. You can't use employer dollars to pay for any individual coverage, or even employee pre-tax dollars to pay for individual coverage. And this bill has been passed. It's been out there. It's probably the last time I'm going to talk about it because I don't know of anybody that has one in place. I contacted earlier this week one of the major administrators of these types of programs, and they're probably going to drop it because they haven't even had one in place, put in place yet, and they don't even want to write them. So, because it's the rules are so complex for small employers. Again, it's a good idea, but the rules are so complex, and the compliance is so complex. Small employers are just throwing their hands up and saying, "Forget it." So, and what I've seen for the large employers, it's kind of the same thing. Yeah, here it is, but you have to comply with all these rules and guidelines, and it gets very, very complex. So, not going to go through this too much. Because, like I said, it's not a big growth area. It's still out there. And if I do another ACA update, I probably won't even have this on there. So health savings accounts, not exactly HSA determined, but I do like to talk about health savings accounts. Personally, I'm a big believer in them, and I think as more and more people get educated and learn about them, I think they're a good thing. We're seeing more and more employers here of our clients looking at them more serious. Sometimes they're adding them, sometimes they're saying maybe next year. We don't have too many people that are just moving to those types of plan and only offering that type of plan. But what we do see is employers adding those as a second or third plan option, just to offer to some, folks who see the value in the HSA and have the wherewithal to be able to coordinate their expenses and be insured with a high deductible health plan. So I like to talk about where they're at, what you have to do to be qualified to have a health savings account. So in 2019, the minimum deductible for single coverage is $1,350 and $2,700 for family. So these plans cannot have office or drug copays. You have to satisfy the deductible first. The only exception to 100% coverage is preventive care. So if you have one of these plans, the difference is going to be is, other than preventive care, you're not going to have your office copay when you see the doctor. If you see the doctor, that $30 office copay is now going to be a $150 to $250 cost that you're going to have to pay because it's going to be part of your deductible of $1,350. Now, once you hit that single deductible, then coverage can kick in. Then you can have office copays to pay for office calls. Then you can have 100% coverage. Some plans pay 100% after that deductible. Some have where it's co-insurance and so forth. But those are the minimum deductibles. And that family deductible for that type of plan would be what they call an aggregate deductible, meaning that any one person in the family could satisfy that $2,700 deductible. Or it could be a mixed match of all family members adding up and so forth. On the high side, the maximum out-of-pocket these plans can have is for single $6,750 and for family $13,500. So that's the maximum anybody could spend out of pocket for what you call their covered charges, but you had to pay that because they are part of your deductible, co-pays, co-insurance, and so forth. On the contribution side for 2019, singles can put in $3,500 into their health savings account. Those with dependent coverage, whether it's full family or employee spouse or employee child, they can put $7,000 in their HSA. Now, those amounts are prorated. So if you become health savings account eligible in July, be able to put half that amount in because they're going to be prorated. There are some other guidelines that can allow people to put the full amount in, but we usually recommend not doing that because if you, for some reason, put the full amount in and you don't comply with what they call the full payment guidelines, you have to take money back out of your HSA or be penalized. So we kind of stick with the prorating rules on that. And if you are age 55 or over, you can contribute an extra $1,000 catch-up. That is not only for you, that would be for your spouse as well. If your spouse is also over 55, they'd have to open another HSA, health savings account, but you could put an extra $1,000 catch up in for them as well if you're looking to max out on how many dollars you're putting in and so forth. As I said earlier, we are seeing more employers moving to or adding health savings account qualified plans as a second or third option. And one thing there's been a lot of good webinars lately on this because it is very complex. If you currently have a medical flexible spending account and you want to move, and then your employees want to move from that to a health savings account, there's some pretty complex rules in moving from one to the other and some guidelines. And the key is having a flexible spending account, you can't have a health savings account. So if it's a medical flexible spending account. So when you move and have a flexible spending account, you're moving to a health savings account, it's very, very good to really get somebody in there that understands the complexity of moving to those to make sure that members that move to a plan where they think they can contribute to a health savings account can still contribute to that. So it's just kind of a word of caution there. A lot of other news out there, wellness programs, especially wellness programs that make you meet a certain guideline, make you comply with certain, medical, attain certain medical, like weight concerns, what is it, charts where if you're so high and so tall and so much in weight, I can't think of it right now, but programs that make you meet a certain wellness requirement. There's a lot out there on those. I'll be honest, these webinars, they can be an hour to 2 hours in themselves because of the complexities of the rules, especially now with the Department of Labor and the EEOC kind of having their own rules on these and adding to them. So I'm not going to talk a lot about it, but this slide is going to direct you to our website, housemanjohnson.com. If you go there and you look into the webinar tab and then you look for webinar archives, there's a very good webinar that's been done by an attorney. This is an attorney that actually will be leading our conference call this afternoon, Stacy Barrow. He does a good job, and he I think it was in August of last year, he had a good webinar on, workplace wellness programs and compliance. That's what you want to click on. And, he gets into all these new rules that we have to comply with, especially with the Department of Labor and the EEOC getting involved and so forth. I'll leave it at that. Better presented by somebody who specializes in this, and that's what Stacy does. So you can check out our webinar there and so forth. On again, off again, extensions and delays, small employer plans. So if you're a small employer and you're still on what is called either a transitional, some people call them grandmother coverage, you can keep renewing through 12/31 of 2019. I do expect, as usual, sometime in April, May, June, we'll probably get something out from the administration and DC extending these again. They've been extended now for 5 years or 6 years. I can't remember anymore. But so this allows employers to keep their coverage, that's it's age and gender rated, yet composite rated, and plan designs that were here before the small employer plan designs. That would be the community rated plans that have the platinum, gold, silver, bronze, and so forth. Now, that said, we've had more and more small employers move to those types of plans because initially it was not financially or benefit effective to move to those plans. And now those plans, the benefits in those plans are good, and now the cost of those plans have kind of, the cost of the transitional plans have caught up with the cost of the community rated plans. So where it's made sense, we have moved clients to those types of plans. So there's fewer out there that are on transitional or grandmothered, but you can stay this year. I do feel it's going to be kicked down the road again, but we'll know that probably by by late spring, early summer this year, and so forth. Cadillac tax. That's a tax on high cost health insurance. That's now delayed till 2022, so there's really no concerns immediately there on your plan designs and the cost of what you're paying. We feel that there's really right now bipartisan support to try to just get rid of that tax. The problem that holds it back, though, when everybody wants to get rid of it, is how we're going to replace those funds that we anticipated getting and so forth. There's a moratorium on the medical device tax. That's been extended for this year. And also another tax that does cost employers some money is the health insurance industry tax. That's extended again for 2019. This tax applies to fully insured medical, dental, and vision. Many of you, when you get your renewals, the insurance carrier lets you know, because of this tax, this is how much it's affecting your renewal. And many times that effect was 3 to 5%, sometimes less, sometimes more. But that tax was suspended for 17. It was back for 18, and now it's been suspended for 2019 again. There's scuttlebutt out there to try to extend that delay through 2022, but currently there's been no movement or anything to do that and so forth. So, okay. Now we'll get into a couple bills that were passed in Congress. We pick up the paper all the time. There's a lot of things going on, trying to protect the ACA, trying to disrupt the Affordable Care Act. We know that. We read about that. There's lawsuits everywhere. There's a state lawsuit we'll talk about after this. There's states themselves, because they're worried that the individual marketplaces that are going to dry up and go away are starting to come up with their own individual marketplaces to keep individuals and need to buy coverage and penalties if they don't, since those have been taken away. We could talk about this until we're all blue in our face, but there are two bills I do want to talk about because they were passed. So this first bill, it was passed in July of last year. So it was passed obviously before the elections, and we all know that in Congress there is a big change in because of the elections from who has power in Congress. But this bill had a lot of crossover from Democrats. So the bill passed on 277 yes vote to 142 no vote. Now it's in July. And the reason I want to talk about it, I do feel that there are some things in here that are good. And what happens though is we'll see there's things that aren't so good that are usually attached to them, and that's why they don't end up getting passed. So it was passed by our Congress, but to be put into law, it had to be passed by the Senate before the end of the year, and that didn't happen. So, these laws are right now just passed by the Congress, and there's been no movement on them. I do feel, though, that some of these things we might see coming up in new legislation that will be passed and so forth. So this bill would have allowed a carry forward of FSA flexible spending account balances up to 3 times the annual flexible spending account limit. That would have been a great benefit because right now it's still in my mind it's use it or lose it. Yes, there is that carryover benefit of 500, but again, I don't. This would be a much better benefit. So employees should still put money in flexible spending accounts and carry over up to 3 times. That'd be a great benefit for employees. I would like to see something like that. The next one, entitlement to Medicare Part A. due to your age, not disrupting HSA eligibility, health savings account. Right now, when members turn 65, it's complex for them if they want to keep contributing to a health savings account. We all know when we turn 65 that Medicare Part A, I hate using the word free when we talk about health care, but it is free. There's no cost to it. So many members just say, well, if I don't have to pay for it, who cares if I have group insurance or not through my employer? I might as well have Part A. So when they do all their signing up, what they need to do at that age with Social Security for Medicare, many just take Part A. As soon as they take that, they might have a high deductible health plan at their place of work that qualifies them to contribute to a health savings account, and then they can no longer contribute. So this is an area a lot of people just don't understand, and this would take a lot of confusion out of that. And so I have no problem with this at all. I'd like to see this passed just to take that confusion out. Now, you can't sign up for Part B, but many don't, because why would they pay the Part B premium if they have coverage through their employer, where Part B doesn't even hardly pay anything because your employer plan pays primary. So, but this would make it a lot easier. This one I'm not sure if I'm a big backer on. Increase HSA contribution limit to whatever the out-of-pocket limit is for high deductible health plans to qualify for a health savings account. Well, now we're talking $6,750 and $13,500. I think there's a lot of, people are going to say, well, this is, a benefit for the wealthy. And be quite honest, I think it would be seen that way, and I don't know how anybody can say it can't, because I don't know how many people out there, if you're single, can put $6,750 in a health savings account or the $13,500. What I'd like to see, the current limits of $3,500 and $7,000, I think are pretty good. What I'd like to see is when employers contribute, a lot of employers do when they move to health savings account type plans because there's savings to them as well. I'd like to see the employer contribution not be included in the total amount that you can put in your HSA for the year. I'd like to see, so if your employer puts in $500 for those that have single health savings account coverage, I'd like to see the single person still be able to put up to $3,500. Yeah, that'd be more workable, and I think that'd still be a good benefit for employees. So that could be taken out. Allow both spouses to make catch-up contributions to the same HSA. I agree with this. Again, as I mentioned earlier, that catch-up contribution, you have to open for your spouse. If they're 55 or over and you want to make the additional $1,000 contribution, you have to open up a separate health savings account. I'd like to see one account and let both spouses contribute to that account to whatever that maximum might be if they're both over 55 and so forth. Extend the moratorium on the health insurance industry's tax for 2020 and 2021. I talked about that a little earlier about the legislation for that. If that's not extended, the health insurance tax will come back next year. You're going to start to see it on your renewals. Insurance companies telling you that here's your renewal, is this, and the health insurance tax is 3 or 4 or 5% of that renewal and so forth. So obviously that'd be nice to see that moratorium go away. Another thing I'd like to see is currently when you have a plan that qualifies for a high deductible, if it's a qualifying high deductible health plan for a health savings account, if that coverage is effective January 1st, you have to have your health savings account open prior to January 1st to be able to use it for claims. If you wait and you procrastinate and you wait until February, you can still open your health savings account, but you can't use it for claims that occurred in that month of January. This would give you a 60-day grace period. This will allow employers to move to these plans, get you educated on them, and if it takes a while to actually get the actual account set up with whatever financial institution you're going to use, it gives you a 60-day grace period. So, if it's open within 60 days, you'd be able to use it for qualified expenses. in that first 60 days. Bronze and copper plans. These are plans that are written through the marketplace. This will allow bronze, what they call bronze plans or copper plans, no matter what they had for benefits, as long as they're established as a bronze or copper, they'd be HSA qualified. I don't see a problem with that either. Some of these plans do have some first dollar coverage, and which would disqualify them for a health savings account, and that would open that up. And you know, copper plans allowed for all marketplace enrollees. Currently, copper plans are only eligible to people that are 30 and younger, and this would open them up to all ages that would want to apply to individual coverage in the marketplace. So I don't have any problems with any of that either. I'd like, you know, anytime you can offer coverage that's low cost, that people are willing to purchase and accept the risk, I think that's a good thing. The other law that was passed, well, it's not a law until it's passed by both parties, I guess, or both houses of the both House of the Congress and the Senate, but it was passed by the Congress again, but did not get through the Senate, so it's not law. It's again trying to make plans that comply, you know, currently for health savings accounts, you know, to make them a little bit more attractive for people to first move into them. So it's basically offering more first dollar coverage. One thing we do see, and there's studies out there, and you know, I think it's proven, is adherence. You know, someone moves from a plan that has an office copay and a drug copay, and they go to a plan that no longer has those, and they have to pay for all their medications until they hit their deductible, or all their office calls until they hit the deductible. We do see, and there are studies where people might skip a doctor's visit, maybe cut back on their medications, things like that. And that's not good. Adherence is important with healthcare. Adherence is important with following your provider's orders and what you should be doing to stay healthy and keep yourself well. So we think this is important as well. So I'm going to go through this quick because I'm getting late on time. This bill was going to allow up to $250 for single, $500 per year in coverage that could be provided before the deductible is met. That's total coverage. That's a good thing. Up to $150 to $300 per month of direct primary care would not disrupt HSA eligibility. Direct primary care is like having a doctor on retainer. You pay a set flat amount, or like a concierge type provider, you pay a set amount. We don't have that around here at all, but some parts of the country do. It will allow you to have that type of relationship, and it wouldn't disrupt HSA eligibility. I'm fine with that. Services at on-site or retail medical clinics, as well as even like telehealth type systems and so forth, would not disrupt HSA eligibility. This is a big one here. Spousal flexible spending account enrollment won't disrupt employees' HSA eligibility. I'm a big proponent of that because I think there's a ton of that going on where I have an HSA here at Hausman Johnson and my spouse works someplace else and she's contributing to an FSA where I'm eligible to get funds under that. That happens. That's not happening here, folks, but I'm using that as an example, but that's happening all over the place. It's hard to track, it's hard to catch, and this would take a lot of that questioning out. Over-the-counter medical products allowed as qualified expenses. Employees would be allowed to convert up to $2,650 or $5,300 if family of their FSA funds and balance that into upon enrolling into a health savings account. It also would include HRA, but we don't have very many employers that allow funds to be built up in HRAs. It's either there or once a year it's done. If you didn't use it, it's gone. It starts all over again. But so that would be good. And amounts paid for qualified sports fitness expenses eligible up to $500 or $1,000. I'll be honest, I'm a little green on little gray on this because I've seen this as an excludable expense, meaning does that come off your taxes every year? And I've also seen it related to eligible expense, which would mean you could use HSA funds to pay for that. Well, since it wasn't passed, I'm going to I don't think we're going to get much more on it, but anything that helps people keep healthy, I'm for. And again, delay the health insurance industry tax. There's a lot of movement out there to do that. Last piece we're going to talk about, looking ahead, the piece that's out there that we're going to hear more on late May or June of this year is the ACA litigation. Basically, the state of Texas and versus the U.S. Some people say state of Texas versus Azar. Well, he's our current Health and Human Services Secretary. There's been 20 states and 2 individuals claim that since the ACA is invalid because of the elimination of the individual mandate tax. Remember back to 2012, the ACA might have been blown up back then if the Supreme Court stated, ruled against the individual mandate and so forth. And what happened was everybody was calling it a penalty, and the Supreme Court said, no, it's a tax. So it's legal, we move forward. So now people are saying since the tax is zeroed out, the individual mandate should be rendered unconstitutional, which would blow up again the whole ACA. That's kind of it's inseparable, they're saying. So we're going to hear more about that. Who knows how it's going to go. Again, the Supreme Court hasn't really changed. If the people vote the same way, they're still there. We've had a couple people replace Supreme Court members, but we figure their yes vote would replace a yes vote that was back in 2012. The one no vote that surprised everybody is still there. So we don't know how that's going to move, but that's one thing we're all watching and so forth. Sorry, folks, everything else is speculation. I know we're hearing a lot about Medicare for all. We're hearing everything, now we have, obviously, Congress wants to do things. Our Senate's going to block things. They want to do things. Congress is going to block what they want to do. So, unfortunately, I think until the next elections, we're not going to see a lot of activity unless it's litigation and legal activity that gets to the Supreme Court. So, that said, button right up to our hour. So I appreciate your patience. And if there's any questions, I'll see what we have, and we'll try to answer as many as we can.
Yes, if you have any questions, feel free to enter them in the questions feature, and Pat will answer them as quickly as time allows. We do have one question here. Did you say he can contribute 1,000 catch-up for self and spouse to an HSA?
It's 1,000 each. Now, I'll use myself for example. I turned 55 before my spouse, so I contribute to my catch-up. Once my spouse turned 55 a few years later, we open up an account in her name and contribute another 1,000. So if both the employee and the spouse are over 55, you can each contribute $1,000 extra to your health savings account. The confusing thing is you have to open up an account in your spouse's name to do that.
What are the guidelines on HSA reimbursement for medical expenses?
You can go on the IRS website and Google eligible HSA expenses. A lot of them say maybe. You may be able to, use your dollars to pay for this. Because there's a lot of, I'll guarantee what you can use. Medical expenses aren't paid because of your deductibles and copays. Dental expenses aren't paid because of your deductibles and copays. Vision expenses can be. When I'm in an employee meeting, I usually stop at that. And I say, if you use it for that, it should be good to go. Are there other things you can use it for? Medical mileage, yes. Who's trying to, that's fine. If you got a lot of medical miles because you're traveling to another area, that's great. Total it up, use it. Oh boy, there's more things beyond that I just kind of, because it always says maybe, and I don't like to say you know, in my mind, yeah, you can use it for this, this, and that, because if someone comes back and says, I got audited by the IRS, and they're saying no. Best thing to do is go on the IRS website, look up, Google HSA eligible expenses, take a look at it, and where you feel comfortable, go ahead and use your dollars for that. Because remember, HSA dollars, you have a checkbook, and that checkbook or that credit or that debit card is not going to stop you from using that at places like grocery stores, you know, for food items, things like that. It's up to you to keep your receipts and have those there if you ever get audited by the IRS. And hopefully all those receipts you have are for eligible expenses.
All right, back to the spouse contribution with HSAs. If the spouse doesn't work and is over 55, can the working spouse make the contribution?
Sure, I can use, they're not my dollars because they're our dollars. So yeah, anybody, you can contribute your money into your spouse's HSA. What you won't be able to do is you won't be able to pre-tax those in. You know, you'll have to take a line, you'll have to put the $1,000 in the spouse's health savings account, and then at the end of the year when you file your taxes after the end of the year, you'll have to take, you know, a line item deduction off the top, you know, where you said, hey, we contributed $1,000 into this HSA. Just be like an IRA. You know, that's the difference is you're not going to be able to pre-tax those in, but you can use any money to wherever it comes from to put that $1,000 into the spousal HSA to get the tax deduction.
All right. Well, thank you all so much for attending today's webinar. As a reminder, please fill out the short survey sent to you, as your feedback is incredibly important to us. We would love your feedback online as well. If you'd like to post on LinkedIn, Google, or Facebook, just remember to tag Hausman Johnson Insurance. We hope you can join us for our next webinar on April 18th on an introduction to healthcare data analytics. You can sign up for our upcoming webinars on the Hausman Johnson website. And thank you guys so much again for attending, and have a great rest of your morning.